believe there's a common thread between attraction and retention that we have to be acknowledging in order for us to retain our current employees and attract the potential new ones. So I suppose that's probably the hard transition then to your original question, which on the surface, has those two parts, attraction and retention, right? So we believe that they're very much interconnected and that there is this common thread. And I'd say that at the core, we have to create a work environment where talent wants to stay because they feel that they're a part of something greater than themselves, that there's a personal satisfaction, recognition, reward that also has to be gained from being here at Medical Leverage. If those pieces are out of balance, then we believe sustainability is not possible. So what else do we think is included in this common thread? I would say we continuously survey our employees to try and identify those strengths and ones that need attention so that we can focus on those as a leadership team and as a company, always with the goal of creating favorable working conditions and opportunities so that we can retain our existing employees and attract the new ones. They have to, I think, have a couple of things in mind. First of all, adult learning principles tell us that they need to become educated, then they need to apply, then they need to demonstrate some level of mastery, and experience is the key in that realm, I think. So how can you get experience? How can you become educated? Those are, I think, the pathways that a candidate needs to think about. If they're in school and university right now, enroll in classes that have a digital aspect to it so that you're becoming familiar with vocabulary and techniques and methodologies. Learn the industry because, as you may know, Annabelle, it's multifaceted. It's got manufacturers, and within manufacturers, there's touch points like marketing and medical and clinical. And each one of those speak a little bit different language. There's healthcare providers, there's patients and patient advocacy groups, there's payers, there's teaching institutions and centers of excellence, there's hospitals and integrated delivery systems. Of course, there's medcoms and ad agencies. And then there's therapeutic expertise, right? So if a candidate is a PhD or they're a physician that wants to do more medical writing than actual clinical practice, then therapeutic expertise means something, but you have to balance that between depth of knowledge versus breadth of experience, right? And I think that has to be the candidate's personal choice. So, does the candidate, I think they need to look for internships, Annabelle, and it has to be, more than just a 30, 60, 90 day. Really, I would encourage people to look for those 6-month internships where you can sink your teeth into something for a little while. I think mentorship programs are very important. So if your school has one, enroll in it. If it doesn't have one, see if you can start it. And if the school's not interested in starting it, call me because we'll do it. As I've had the good fortune of working with my alma mater, University of Arizona, in a mentoring role, and I've achieved, I've had just a wonderful experience watching my mentee have success in the healthcare industry. If they're already in the workforce, then invest in continuing education webinars, especially those related towards digital communications. Extremely important. Find industry networks and forge relationships. There still is a lot to be said for who you know. It opens doors, creates opportunities. And then I think because you're, as a candidate, thinking about the communications field, you have to always sharpen your verbal, nonverbal, formal, written communication skill set. And above all, be incessantly curious.